You are the nurse in a primary care clinic taking care of a patient with spastic bladder. Her physician prescribes oxybutynin for symptom relief. Which of the following best describes the mechanism of action of oxybutynin? A. Calcium channel blockade. B. Antagonism of M1, M2, and M3 muscarinic acetylcholine receptors. C. Direct thrombin inhibition. D. Beta adrenergic blockade. E. Alpha adrenergic blockade. The answer is B. Antagonism of M1, M2, and M3 muscarinic acetylcholine receptors. Oxybutynin reduces muscle spasms of the bladder and urinary tract. Oxybutynin is used to treat symptoms of overactive bladder, such as frequent or urgent urination, incontinence, urine leakage, and increased nighttime urination. In patients with spastic bladder, oxybutynin exhibits its anticholinergic effects most significantly on the smooth muscle of the bladder detrusor muscle, which helps to treat the patient's symptoms associated with spasm of the muscle, which often manifests as urinary frequency or urgency, with or without urinary incontinence. What is the primary effect of botulism toxin? A. Ascending paralysis. B. Nausea and vomiting. C. Tonic paralysis. D. Flaccid paralysis. The answer is D. Flaccid paralysis. Botulism is a rare and potentially fatal illness caused by a toxin produced by the bacterium Clostridium botulinum. Botulism toxin inhibits acetylcholine release from the presynaptic nerve terminal, causing flaccid paralysis. Death in botulism exposure is generally due to respiratory failure. Tonic paralysis is the cause of respiratory arrest in other toxicity exposures, such as exposure to tetanus toxin. What organism causes Rocky Mountain spotted fever? A. Rickettsia rickettsii. B. Ehrlichia chafensis. C. Rickettsia helvetica. D. Borrelia burgdorferi. The answer is A. Rickettsia rickettsii. Rickettsia rickettsii causes Rocky Mountain spotted fever, and is spread by dermacenter ticks. It causes fever, headache, muscle pain, and a rash. Doxycycline is the drug of choice for the treatment of Rocky Mountain spotted fever, including in children. The risk of dental staining in the treatment of Rocky Mountain spotted fever is very low, as dental staining is a cumulative dose effect, and treatment for Rocky Mountain spotted fever is typically 7 to 10 days. There is no vaccine against Rocky Mountain spotted fever. Prevention of infection requires careful attention to tick avoidance, including insect repellent, long clothing, and checking for ticks after any outdoor activities in endemic areas. Borrelia burgdorferi is associated with Lyme disease. Ehrlichia chafensis is associated with human monocytotropic ehrlichiosis, and Rickettsia helvetica is associated, very rarely, with meningitis. What is the most common cause of infectious diarrhea in HIV-positive patients? A. Clostridium. B. Campylobacter. C. Salmonella. D. Cryptosporidium. The answer is D. Cryptosporidium. While all of the listed organisms can cause diarrhea, Cryptosporidium, a protozoa, is the most commonly isolated organism in HIV-positive patients presenting with diarrhea. What is the most common infection preceding the development of Guillain-Barré syndrome? A. Staphylococcus aureus. B. E. coli. C. Campylobacter jejuni. D. Salmonella. The answer is C. Campylobacter jejuni. 30% of cases of Guillain-Barré are preceded by infection by Campylobacter jejuni. There is no known association between Staphylococcus aureus, Salmonella, or E. coli and Guillain-Barré syndrome. All of the following are frequently implicated in epiglottitis except A. Campylobacter jejuni. B. Staphylococcus aureus. C. Streptococcus spp. D. H. Influenza type B. The answer is A. Campylobacter jejuni. The most commonly implicated bacteria in epiglottitis are Haemophilus influenzae type B, Streptococcus species, and Staphylococcus aureus. Campylobacter jejuni is a common cause of food poisoning. Which agar would be the best choice option to identify Escherichia coli? A. Selenium-enriched media. B. EMB, eosin methylene blue. C. Nutrient agar. D. Phenethyl alcohol. The answer is B. EMB, eosin methylene blue, because it is selective and differential. Escherichia coli is a facultative, gram-negative, lactose-fermenting bacteria. EMB, eosin methylene blue, or MAC, McConkey, media is superior for isolating Escherichia coli because it is both selective and differential. Nutrient agar is neither selective nor differential. Selenium-enriched media would not help identify this bacteria because Escherichia coli does not require this supplemented media to grow. Phenethyl alcohol can be used to select for anaerobic bacteria, which is of no utility in this situation. Which of the following sexually transmitted infections is mismatched with its causative agent? A. Gonorrhea, Nclex gonorrhea. B. Syphilis, Treponema pallidum. C. Toxic shock syndrome, Staphylococcus aureus. D. Genital warts, herpes simplex virus. The answer is D. Genital warts, herpes simplex virus. Genital warts is caused by human papillomavirus. All other sexually transmitted infection is correctly matched with its causative agent. Which of the following organisms causes fever, headache, fatigue, myalgia, and buboes? A. Borrelia burgdorferi. B. Bacillus anthracis. C. Staphylococcus aureus. D. Yersinia pestis. The answer is D. Yersinia pestis. The question stem describes bubonic plague which is caused by Yersinia pestis. Staphylococcus aureus causes skin infections, toxic shock, and food poisoning. Bacillus anthracis causes anthrax, which is similar to plague, but does not cause buboes. Borrelia burgdorferi causes Lyme disease, which presents as rash and arthralgia. E. coli, Escherichia coli, are primarily found in the colon of humans, but can also cause cystitis. Which of the following best explains why this occurs? A. E. coli are obligate robes. B. E. coli are microrophiles. C. E. coli are obligate anaerobes. D. E. coli are facultative anaerobes. The answer is D. E. coli are facultative anaerobes. The colon is anaerobic and the bladder is aerobic. This fact explains why E. coli normally lives in an anaerobic environment, but can also survive aerobically. Facultative anaerobes normally live in anaerobic conditions but can adapt to aerobic conditions. Microrophiles describes bacteria that are obligate robes, but are poisoned by high levels of oxygen and thus require specific oxygen levels to grow.